This is the face of a pre-existing condition. Right there. Right there. Baby Alex Lang. Cute little kid, only 4 months old. And his doctor says he's actually
Keep in mind they have
so what's the
insurance.
problem here? His parents' insurance company refused to cover him because he's above average in weight and height.
Wow.
He's a big one, 99 percentile. According to the Rocky Mountain Health Plan, Alex is obese, even though he can't even eat solid food yet. Now, late today, Rocky Mountain sent out a press release saying, quote, it will cover Alex and other heavy babies. It chalked this up to a denial in a quote that says it's just a flaw in the system.
Oh, now they
Maybe
will.
Alex is going to get health care coverage. That's great news. But don't lose sight of the bigger picture and the bigger problem here, folks.
What is
that
it,
an
bro?
insurance bureaucrat is always between you and your doctor.
Yeah.
And their job is to take care of their profits, not you and your family. Joining me now tonight, the Langs. Dad Bernie, Mom Kelly, and baby Alex. And we'll save the interview for Alex later when he signs with the University of Colorado Buffaloes, because I think he's got real potential here. Bernie,
Oh, shucks.
Bernie, good to have you.
All the help they can get.
That's right. Bernie, your baby is Mr. and Ms. Lang, your baby is perfectly healthy.
Not for real, yo.
How did this unfold, and how did you take this news, and where do you stand right now? What's happening here?
Well, what happened, Ed, is I was looking for a better insurance plan because the rates that I currently have after we had Alex last June went through the roof.
I mean,
So
through the
we
goddamn
had
roof.
the
I just
family
couldn't
covered
afford the
house.
damn thing.
So I started looking around for some other plans. I liked the one that Rocky Mountain
But I'm a
Health Plan
producer.
offered. It was much more affordable with good coverage.
Good coverage.
I started going through the paperwork. I filled out the application, sent in the wellness checks and the immunizations, and just last Thursday I got a call from the broker that we worked through.
Broker?
And they said, Bernie, we can
What
cover
did they-
you, and we can cover your two-year-old son Vincent, but we can't cover Alex.
good.
Because,
What?
Don't take offense. He's too fit.
What?
And I was just left scratching my head. And the healthcare debate hasn't really touched me as much as it has Kelly. But when this happened to a 4-month-old baby, we can't insure.
So that
you
means
because
she has a
you're
story
too
too that
healthy, is
she's
in
not
essence is
telling.
what they're saying.
But we'll focus
My jaw
on
hit the
Alex
floor. I
today.
didn't know what to do. So as a news
Check it
anchor
out.
myself in a small market, I work for KKCO 11 News in Grand Junction. I had to pitch this story
An anchor.
to our own news staff because it was so outrageous. As a result, we got some media coverage to help the debate a little more. And then the Denver Post picked up the story, and then you picked up the story. And fortunately, Rocky Mountain Health they've been very helpful. And my gripe was never ever with Rocky Mountain Health Plans; it's with the system. They have graciously come forward and offered to change their policy for Alex
Graciously?
and for others. But you are absolutely right, Ed.
Public
The
pressure
issue is
had
far
nothing to do
greater
with
than
their
this one issue.
grace.
And
They were
I think,
just
to say that
graceful.
there's a need for reform is an understatement, and this is a glaring example.
I find this one of the most unbelievable stories in this entire healthcare conversation we're having in this country. Kelly, can you tell us about your child? Healthy baby, happy baby? Tell us, and how did you feel when you found out that your baby had a pre-existing condition and couldn't be covered?
I was shocked, almost speechless to the point, because our first son was colicky, and we've had problems
That
with weight
means a
issues
lot of
as far
coughing.
as keeping him up to a healthy weight. And so when we had Alex and his heavy appetite and breastfeeding so well, and then to hear this news that
He was loving to
overweight
feed.
and not insurable was just devastating.
What?
It's very helpless because at this age, what do you do to bring that weight down? He's breastfeeding. I can't let him just sit and cry while he's hungry.
Yeah,
There's
doubt
no
about
more
it.
federal on the
Baby's gonna
market
take
for
what
babies.
he
I mean, what
needs.
the hell do
Bernie,
you
I wanna
do?
ask you, the president of the company today, I understand,
They're so
got
gracious.
involved, and we've got a successful conclusion here. Tell us what unfolded.
Wow,
I understand,
you just
they
helped
put out a
everybody
press
out,
release today
Bernie.
saying your child's going to get covered, and I think this might set a standard and draw
wonder
a
what a
line
public
for other
pressure,
insurance
I mean,
companies in this
option would
country not
do.
to get caught in this. What happened today?
Well, I hope it does. In the midst of this media firestorm that kind of swirled up
Shucks.
unexpectedly today, I did get a phone call from the president and CEO of Rocky Mountain Health saying we'd really like
Little
to help
Guinness.
you out, so we've changed the policy
Sorry.
and the CDC guidelines, and we want to cover your baby. We want to cover other children like that. And I was very grateful for
Mom,
for
get out
Steve
my
to-
ear.
to come forward and help out. And again, he runs a fine operation. It's a nonprofit company, and they're based right here in Grand Junction, as a matter of fact.
Oh, really?
It
Shucks.
seemed like it was just simple conversation,
Simple.
a concern, an issue, and the problem was solved. Wouldn't it be refreshing if lawmakers and health companies and insurance companies on the left and the
Wouldn't
right
it
could
be
come together
refreshing?
and come to a solution?
So
Because
soothing
the
and
result would
just
would
so
be,
American.
a
Wouldn't
happy
it be?
result for somebody like our Alex, who's perfectly healthy and happy and fortunately covered now. But there's
Now?
millions of people out there,
Right.
obviously, that aren't so lucky, and they're probably not going to get
And we're
covered
talking
because
about
the debate
the
is gonna continue to
insured,
rage on.
not the
It's
uninsured.
about politics before people.
We know
And
83%
let's
of
just cut to
us
the chase
have
on
insurance,
Rocky
right?
Mountain Healthcare and
He's
the
insured too,
emergency
and it
here
sucks.
today.
No doubt.
And he has a
Ernie,
great
Kelly,
policy.
Thank you so much. Appreciate your time tonight, and thanks for speaking up.
I know the
Because I'm
video's a
sure
little
there's
long,
other
but I
families
wanted to be
across the
put in
country that have been
context.
denied as well, and this is,
Now you check out the
how it
spinners.
shows just how information is power. All the best to you. Thanks so much. For more, let's bring in our panel tonight.